Okay guys, it's tendon month at Physiologic and we've got Tim Rigby with us today talking to us about tendon tips. So Tim, 5 things you wanted to talk about. Number 1 relates to stretching of tendons.
Yeah, for sure. So stretching for tendon type pathologies is actually can be doing a lot more harm than good. So people come in with a tennis elbow or some pain on the lateral tip of their elbow there, and stretching that can actually make the problem worse.
And what would a stretch of that look like? What do people often sort of come in doing?
So people might come in and they might be doing things like that,
yeah,
and it can feel quite relieving. However, in the long run might be making it worse. That compressive load on the tendon actually might be worse for the tendon.
And unfortunately, if we Google how to treat tennis elbow, unfortunately Google tells us a lot, lots of negative things to do, like stretching, and so often we'll see people who come in who have consulted Google and perhaps not got the best advice. So okay, perfect. So avoid stretching.
Yeah.
Number 2, rapid increases in load.
Yeah. So people often complain about their lateral elbow pain or tendon issue, and it's usually due to a rapid increase in load. So if you can monitor your loading of that tissue, whether or not you're doing a lot more activities where you're loading the tissue up, just be careful when you're loading that tissue, because rapid increases in that loading cycle can make it worse.
Yeah, so too much too soon essentially
Pretty
is what
much,
you're saying.
Too much too soon, yeah.
Okay, and number 3, recovery from a tendon problem. So sometimes we're not sure how much is too much until it's too late. Tell us about that.
Yeah, well, usually tendons feel quite good halfway through an exercise, or they tend to warm up, and patients actually feel quite good when they're doing exercise. However, usually afterwards or the next morning afterwards is when they feel the pain. So just be wary when you are exercising or loading that tendon. It might feel good at the time, but later on may actually be worse.
Yeah, we see heaps of patients who do their rehab but get carried away when it's feeling really good and end up coming into us and saying, look, it's feeling so great, but I just kind of overdid it and didn't know exactly, because it felt good at the time, but the next day it was killing me. So yeah, 100% get that one. And what about rest? Because often people with tendon problems are told by their GP or friends or even Google to rest. Like is like for someone with a long-term tendon problem, is rest a good thing?
Yeah, well, it does depend on what cycle of their tendon they're in. If they've got an acute reactive tendon, which means it's quite fresh, resting for a short period might be okay. But however, for longer standing tendon issues, like you just said, Josh, degenerative tendons, resting actually can be the worst thing for it, and they need load and they need some gradual strengthening exercises to get that tendon to be able to tolerate the load that it should and not have pain. So
yeah, okay, that makes sense. So if I have a tendon problem and do nothing, it's going to possibly get worse. You're saying that I should do exercises to strengthen that tendon?
Yes.
Yeah. Okay, cool. So as a general port of call, what sort of exercises? You were talking about static strengthening just before we did this video. And tell us a bit more about the types of exercises that people might need for tendon strengthening.
So in that initial phase of the tendinopathy, some static strengthening exercises has proven to actually have a bit of a pain relieving effect, and you can use that as Panadol almost. So Josh, you did a video not too long ago about a nice one for tennis elbow, where you just get a weight and you just do a few static holds. So it's not a full contraction, it's actually just holding that muscle contraction in static nature. Yeah. And
static just means there's no joints moving or whatever.
Nothing moving. Yeah.
Okay, yeah, guys, check out that video. It's on our YouTube channel, and we posted it on Facebook as well. It's pretty cool. So again, guys, it's tendon month. Thanks, Tim, heaps.
Yep.
And so just those 5 tips again. Number 1, avoid stretching. Number 2, watch out for rapid increases in load. Number 3, beware of overdoing it with your exercises, because you won't know till the next morning. Number 4, don't rest if you've got a chronic condition. You need some load in your tendon. And number 5, static strengthening is very good as a pain relieving tool. And you can check out our tennis elbow one on that I did a couple of days ago. All right, guys, thanks, Tim.
Sounds good. Thanks, Josh.